Let's jump right into this explainer because today we are unpacking a truly fascinating perspective on human psychology. We're looking at the core premise that our social environments and our relationships act as our greatest, most impactful teachers. From the exact moment we're born, we're essentially enrolled in a lifelong curriculum of human connection. But, what happens when the lessons we learn actually cause us pain? How do our relationships shape our personalities? And most importantly, how can we use them to heal?
Can we actually unlearn our mental distress simply by changing how we relate to the people around us? It's a pretty provocative idea, isn't it? This approach totally flips the script, suggesting that a huge amount of psychological distress isn't some deep, unchangeable flaw inside of you. Instead, it's a product of learned communication patterns. And the absolute best part about something that is learned, it can be retaught.
Section 1, the interpersonal shift.
Okay, let's dive into this. To really grasp this shift in clinical psychology, we first need to look at traditional psychoanalysis, championed by Sigmund Freud. This classic model viewed the mind as this intense battleground of innate biological drives, instincts, and the internal intrapsychic world. But then, in the 1930s and 40s, a group of neo-Freudians emerged and completely shifted the paradigm. They realized that human behavior makes way more sense when you look at it through the lens of social systems. They argued that our personalities aren't just driven by inborn instincts, they're actually taught to us by socialization and acculturation. The dynamic, sometimes messy world of social interactions is where our true development happens.
Moving on to Section 2, our first social teachers. To really understand how this works, we have to talk about the theory of reflected appraisals. This was coined by the founder of interpersonal theory, Harry Stack Sullivan. His theory states that the self is actually constructed from the appraisals of parent figures and other significant adults. I want you to think of your parents or primary caregivers as your absolute first teachers. If their appraisals, meaning the ways they reflect you back to yourself, are highly critical, a child can essentially be taught chronic anxiety and self-criticism. We literally build our identity based on what the most important people in our early lives reflect back to us.
So let's see how this builds into the broader core concepts of interpersonal theory. Those early parent-child interactions provide the absolutely crucial foundation of attachment. And from there, we develop our communication patterns. Dysfunction usually pops up when there's a gap between what we actually feel and what we manage to communicate to others. We also evaluate things like social support, interpersonal functioning, role expectations, and interpersonal conflicts. But the overarching lesson here is that healthy relationships and robust social support act as a vital, necessary buffer against life's inevitable stressors.
Section 3, the IPT framework, or as we can think of it, the therapy classroom.
This brings us to interpersonal psychotherapy, or IPT, which was developed by Gerald Clareman and Myrna Weissman. IPT is a brief, time-limited intervention, usually wrapping up in just 12 to 16 sessions. It operates almost exactly like a highly structured school syllabus. In the initial sessions, the therapist takes a relationship inventory, essentially assessing the client's social history. During the intermediate sessions, they dive into the core curriculum, targeting very specific themes. And finally, the termination phase prepares the client to take everything they've learned out into the real world. Throughout all of this, the therapist acts as a participant observer, guiding the client through a structured, highly safe learning process. Now, what's really interesting here is this very specific technique used in IPT. The therapist explicitly absolves the patient of responsibility for their symptoms. This is a fascinating, almost completely counterintuitive intervention. Instead of letting the patient feel guilty for their struggles, the therapist squarely blames the illness of depression. By totally removing the burden of guilt, the therapist clears the emotional runway. This allows the patient to focus entirely on learning new social and communication skills without constantly beating themselves up.
Section 4, the 4 interpersonal lessons.
During that intermediate phase of IPT we just talked about, the therapist will identify one or more of these 4 target themes to focus the curriculum on. First step is grief, which is all about promoting healthy mourning after a major loss. Second is role disputes, which involves resolving active conflicts with a partner or a loved one. Third is role transitions, helping a client adapt to massive life changes, like starting a new job, moving, or becoming a parent. And fourth is interpersonal deficits, which really focuses on building basic social skills and expanding a social network. Take a quick second to reflect on your own life. How are you currently navigating these 4 areas? Are there uncommunicated role expectations causing friction in your own relationships right now?
Section 5, case study Michael.
Let's put this into practice and look at Michael's situation. He's a law student who came into therapy experiencing severe depression.
But here's the key. This onset occurred right after he went through several major life moves and geographic dislocations. From an interpersonal perspective, we aren't immediately digging around for a deep, hidden childhood trauma here. Instead, we look straight at his environment. Michael's environmental shifts and his sudden jarring lack of social anchoring were the direct triggers for his psychological distress.
So the crucial point is how his therapist took that distress and mapped it directly onto the IPT syllabus. The therapist identified 2 specific slices of the curriculum to focus Michael's reteaching on. First, a role transition issue related to the massive shift of moving and starting law school, and second, interpersonal deficits, specifically addressing his intense internalized feelings of rejection that were making it incredibly hard for him to connect with his new peers.
The intervention itself was super practical and focused. The therapist first normalized Michael's reactions to being uprooted, basically validating that, yes, dislocation is objectively really hard. Then, the real learning began. The therapist worked on reteaching Michael how to effectively communicate his feelings of rejection rather than just withdrawing into a depressive shell. By practicing these new communication skills in the safety of the therapy room, Michael was eventually able to graduate from therapy, celebrating his newly mastered skills and experiencing a massive improvement in his mood.
Section 6, Effectiveness and Cultural Limits.
Let's weigh the evidence on this approach. On the advantages side, IPT is highly practical. It has massive empirical backing. It's firmly established as highly efficacious for adult depression, with studies actually showing its impact on social functioning is often superior to just taking medication alone. Its time-limited nature also makes it super acceptable to most clients. However, looking at the limitations, its narrow focus on current stressors means it might miss broader, more existential issues. For clients who are really looking for deep, lifelong intrapsychic insight, this practical, socially focused curriculum might just feel a bit too brief.
And this brilliantly illustrates a vital consideration when applying these concepts globally. When we teach social functioning, we constantly have to ask, whose social rules are we actually teaching? We have to contrast individualistic cultures, which are common in Euro-American societies, where individual autonomy is seen as the ultimate goal, against collectivistic cultures, where family interdependence is actually viewed as the highest sign of health. Practitioners absolutely must be mindful and adapt their teachings. You literally cannot apply a Western goal of individual autonomy universally. What's considered a healthy role expectation changes dramatically depending on the cultural classroom you are standing in.
We've covered some incredible ground today in this explainer, exploring how our minds are fundamentally shaped by the people around us. So I want to leave you with this final, provocative question to consider. Are your social connections acting as a vital buffer for you right now, or are uncommunicated role expectations causing hidden distress in your life? Our relationships truly are our greatest teachers, but it's ultimately up to us to make sure we are communicating effectively within them. Thanks so much for joining me, and I encourage you to keep questioning, keep learning, and keep evaluating the social connections that shape your world.